Hello, my name is Dr. Nicholas Cohen. I'm a family doctor, and I'm here to share with you tips for fibromyalgia. Tip number 1. If you are suffering from fibromyalgia or think you may be suffering from fibromyalgia, the most important thing to do is to have your suspicions confirmed by a doctor. Usually people with fibromyalgia have muscle pain all over their body, and there are certain tender points on the body that your doctor can assess. It's also important to make sure that there is not a more serious illness that could be similar to fibromyalgia. So your doctor may send some blood tests, including a complete blood count, a thyroid function panel, as well as an ESR to check for alternative diagnoses. So tip number 1 is to make sure you actually do have fibromyalgia. Tip number 2 is education. Knowing about fibromyalgia is one of the most important factors in feeling better and is an integral component of treatment. Fibromyalgia is not something that's in your head. It is an actual disorder, and it's not a problem that will deteriorate. It will not lead to death or worsening health. Additionally, it's not deforming. It will not lead to joint swelling. It will not lead to loss of function of different organs. It is also not an infection. It's important to note that fibromyalgia symptoms, which are diffuse body pain, difficulty sleeping, commonly depression and fatigue, have a waxing and waning course, which means they can get better and then they can get worse. And it's a chronic problem, so that at times you may feel better and at times you may feel worse, but you should always know that symptoms will change. And lastly, it's important to know that people with fibromyalgia, in almost all cases, are able to lead normal lives. Tip number 3, aerobic exercise. Aerobic exercise is a very important component of treatment of fibromyalgia. And aerobic exercise means any activity that increases your heart rate. So the recommendations are that people with fibromyalgia engage in physical activity for 30 minutes a day and for at least 3 days a week, but preferably for every day of the week. A great option is to go walking for 30 minutes. An alternative is to go swimming or to get involved with a swimming program that can potentially be specifically for patients with fibromyalgia. Other options are yoga and bicycling. Anything that gets your heart rate up for 30 minutes, 3 or more days of the week, has been shown to be helpful for treatment of fibromyalgia. Now, not only does it improve pain and decrease fatigue, but it also improves general well-being. Tip number 4 is cognitive behavioral therapy. Cognitive behavioral therapy is something you can be referred to by your doctor, and generally sessions are once or twice a week for 12 weeks, where you learn about fibromyalgia and you learn how to process the different sensations that your body has, and how through exercises with your mind you're able to control and improve the symptoms of fibromyalgia. Cognitive behavioral therapy also has been proven to improve patients' well-being and improve symptoms in cases of fibromyalgia. Tip number 5. The next tips are different medication options for treatment of fibromyalgia. The first, tip number 5, is amitriptyline. Amitriptyline is probably the most commonly prescribed medication for people with fibromyalgia. It's a tricyclic antidepressant. Usually the starting dose is 5 to 10 milligrams, and it's taken about 1 to 3 hours before bedtime. This is prescribed by your doctor, so of course you should talk to your doctor about the best first treatment medication for your condition. Usually the maximum effective dose is 50 milligrams, but you should increase by 5 milligrams starting at 5 you should increase by 5 milligrams about every 2 weeks until you reach the 50 milligram dose. You may have optimal improvement with a lower dose. It's important to know that the dose of amitriptyline is basically based on how well it improves your symptoms and the lowest possible dose that you can tolerate without significant side effects. The side effects that can limit the dose of amitriptyline are dry mouth, constipation, fluid retention, weight gain, grogginess, and decreased concentration. People who are taking amitriptyline and find that they generally are depressed throughout the day may consider adding fluoxetine, which is a selective serotonin reuptake inhibitor. And this is frequently dosed at 20 milligrams in the morning. Ask your doctor about adding fluoxetine to your currently prescribed dose of amitriptyline if you are feeling depressed during the day. Tip number 6 is pregabalin. Pregabalin is an alternative option to amitriptyline as a starting medication for fibromyalgia. When having sleep problems is a main feature of your fibromyalgia, then pregabalin is a good thing to consider as an alternative to amitriptyline, because people with sleep problems tend to have better sleep after treatment with pregabalin. Pregabalin is initially dosed at 25 milligrams at bedtime and can be increased gradually up to 300 to 450 milligrams at bedtime. Although many patients can achieve optimal symptom control with as low as 100 milligrams of gabapentin, of pregabalin. So it's important to go slowly with the dose and find the lowest dose that has maximum improvement for you. Tip number 7 is duloxetine. Duloxetine is a third option as a first medication to try when you have fibromyalgia. This is a particularly good medication to use if the most bothersome symptom of your fibromyalgia is fatigue or exhaustion during the day. Patients who are significantly tired during the day have a real benefit when they use duloxetine as the primary medication for their fibromyalgia. Duloxetine is a selective serotonin and norepinephrine reuptake inhibitor. It's particularly useful when exhaustion is your main symptom, and the starting dose is usually 20 milligrams at breakfast. It can be increased about every 2 weeks by 20 milligrams up to the maximum recommended dose of 60 milligrams each morning. Ask your doctor if duloxetine is a medication that might be helpful for you. So those were 3 of the most effective and commonly prescribed medications to consider for your treatment: amitriptyline, pregabalin, and duloxetine. Tip number 8. Avoid opioids and steroids. Opioids such as Tylenol 3, Percocet, Dilaudid, morphine are commonly prescribed for fibromyalgia because it is a disorder that involves pain, but pain is not improved for people who use narcotics in treating fibromyalgia. And in fact, narcotics like the ones I just described actually lead to worse functioning and worse concentration and worse overall well-being when used to treat fibromyalgia. So it's important to avoid these medications. It's also important to avoid steroids. Steroids are used for inflammatory conditions. Fibromyalgia is not a condition that involves inflammation. And steroids have a lot of side effects that have serious negative impact on your health, including hypertension and bone loss. So it's important to avoid steroids as well as narcotics in the treatment of fibromyalgia. Tip number 9 is consider referral to a multidisciplinary program. Multidisciplinary programs typically are used for any patient with a chronic pain syndrome or chronic use of pain medications. These programs involve rheumatologists, physical therapists, mental health experts, physiatrists, and can be helpful in conjunction with treatment from your primary care doctor. These programs are particularly good if you and your primary care doctor are not able to get control of your fibromyalgia using the recommendations that I've described above. And tip number 10 is believe in yourself. Fibromyalgia is a disorder that is not in your head, and it's one that can be effectively managed and controlled, and you can live a happy and healthy and high quality life with the diagnosis of fibromyalgia. So I hope some of these tips have been helpful, and thank you for listening. Have a great day.